ranks the likely impact of risks, found that infectious diseases are only number 20 out of 32 perceived risks in the short term, and number 27 in the long term. And in terms of risk preparedness, the same survey finds that leaders perceive infectious diseases as the risk for which the world is best prepared after terrorist attacks. We see things very differently. The unfolding tragedy in Turkey and Syrian Arab Republic underlines how vital it's that all of us as nations and as a global community strengthen our preparedness for, response to, and resilience against health emergencies. I'm pleased to inform you that WHO's first flight with medical supplies and surgical trauma kits will arrive in Adana, Turkey, tomorrow afternoon. The loads for the second and third flights for Damascus are ready to go, pending administrative clearance. We will also be sending a high-level delegation to coordinate and oversee our response. Excellencies, dear colleagues, the agenda you're sending to the World Health Assembly reflects the huge scope of the organization's work and the scale of health challenges we face around the world. Behavioral sciences, diagnostics, disabilities, drowning, infection prevention and control, medical devices, meningitis, mental health, polio, refugee and migrant health, rehabilitation, substandard and falsified medicines, traditional medicine, and more. You have also given us important guidance on well-being, health promotion, the social determinants of health, and non-communicable diseases. As we celebrate our 75th anniversary, we face a year of great challenges: the ongoing COVID-19 pandemic, continued conflict, climate change, outbreaks, and more. But we also face a year of great opportunities. Negotiations on the pandemic accord and the international health regulations, high-level meetings on tuberculosis, universal health coverage, and pandemic preparedness and response, and more. Together, we must meet the challenges in front of us and seize the opportunities. Thank you all once again for your work this week. Dr. Petric, my special thanks to you for your outstanding leadership this week. You have led us with a clear sense of purpose and a good dose of humor. We're reminded that in our fractured and divided world, health is one area in which member states can come together to find shared solutions to shared problems. As always, we need health for peace and peace for health. I look forward to working with all member states to promote, provide, protect, power, and perform for health. Thank you so much, and all the best, and I wish you all safe travel. Thank you so much.
Thank you, Dr. Tedros. I think it's time now for me to say some farewell words to all of you. We have come to the end of the session of 152nd EB. I would first and foremost like to thank you all for a very constructive and rich discussion. We have covered many topics over the last 2 weeks, and I have heard from you many great ideas for how to proceed and improve to make our work and the organization even more transparent, efficient, and accountable. An organization that deserves trust. However, the discussions, although important, are not worth much if not leading to implementation. To ensure that implementation would even be feasible in all our regions and countries, we have to listen to each other. I believe that the guiding questions helped in this regard, as did the statements posted in advance, so that we could read what other countries, EB members, but also non-state actors are thinking is important. I would also like to remind you that out there are people that are listening to our discussions, and they might think, what will come out of this? What is there for us? We, and by saying we, I mean all of us, the EB members, the member states, the non-state actors, the observers, everyone, we should know better. We should not only have our discussions open to the public, but should also strive to have our messages clear for everyone to understand why, what, and how we will be doing to succeed with our aims in increasing health of our populations, in ensuring that everybody is entitled to high-quality care, including access, which we have discussed during our sessions, to diagnostic, high-standard medical devices, medicines, and rehabilitation. And in doing so, we should also be able to contribute to development, but even more important, what has been just mentioned by Director General, to peace. I see Global Health for Peace as one of the most important initiatives. Dr. General, Dr. Tedros, thank you for demonstrating at the event of the earthquake in Turkey and Syria that our organization can and is able to respond in such crises immediately, on the ground, very transparently and very competently. Thank you for this. We all have a role to play to ensure that this organization keeps delivering. I will continue to play mine as long as I'm your chair and as an EB member. And I thank you for your tremendous support so far. In line with this, in line with what I have just said, I am informing you that the next retreat of the EB will be in March. And you will get all the information soon. It is decided in a way that this will be the first week of March, and if we will have a special session, it will be aligned to the special session. If not, we will have retreat anyway, because there are many things that we have discussed. You see, everything is a process. By doing something once, it doesn't lead you to appropriate solution, and in particular, it doesn't lead you to implementation. So saying that this is a process, improving our ways of working at EB, I'm also counting on you, the EB members that are there, on those to come, to continue this process and to improve our ways of working further. There are so many people I would like to thank at the end of this meeting. First and foremost, the DG and his team, who I could always rely on for support and guidance. Thank you to the interpreters for your excellent work in making sure we can understand each other. I was an interpreter many, many years ago, and I have to admit you did a tremendous work. Us speaking fast, us speaking too much. We are really grateful. Second, to my fellow EB members for your cooperation in trying to improve the ways of working and taking it seriously, and for very rich input. The last experience with you discussing this last item and trying to reach consensus to me is very dear. I can see that we, people working in health, we can proceed and we can come to conclusions if we want, because we know what is at stake, health of all our populations. And finally, to all member states, I would like to thank for their inputs, ideas, and additional guidance to the organization. And it wouldn't be me if I wouldn't thank also to all the non-state actors, because you all know that what I'm keeping saying, there's no implementation without those people there on the ground. So thank you also for contributing to discussions. And with these words of appreciation, I would like to bring this session to the close. Thank you very much.